Welcome to The Explainer. Today we're diving into a topic you probably think you know, but trust me, it's way bigger and more complex than most of us realize. We're talking about diaper need. And no, it's not just about babies. It's a quiet crisis that touches millions of Americans, young and old. All right, let's get into it. So, right off the bat, when I say the words diaper need, what's the first image that pops into your head? Yeah, for most people, it's a baby, right? Maybe a new parent looking stressed at the store. And look, that's definitely part of the story, but it's just one piece of a much, much bigger puzzle. The reality is that common picture we all have in our heads, it's just too small. It completely leaves out huge groups of people, other children, adults with disabilities, and seniors, who all depend on these products just to live a healthy, dignified life. To really get a sense of the scale here, just look at this number, 1 in 2. That means nearly half of all families in the U.S. say they've struggled to afford diapers. Let that sink in for a second. Half. That's a massive number, and it tells you right away that this isn't some niche issue. It's a major public health crisis that's been hiding in plain sight. Okay, so let's make sure we're all on the same page. In this first section, we're going to clearly define what this problem is, what we mean when we say the diaper divide, and who it's really affecting. So the official term here is the diaper divide. And while it starts with not being able to get or afford the products, that's just the beginning. The consequences just spiral out from there. It's not just a budget problem. It's a crisis that hits your physical health, your mental well-being, and even your ability to just go out and be part of the world. And this chart just completely blows up that it's just for babies myth. I mean, look at it. Sure, infants and toddlers make up about a third of the need. But when you start adding up the other slices, children, adults, seniors, those with disabilities, you're looking at a staggering 2/3 of the total need. It's proof that this is a lifespan issue, plain and simple. Now that we've got a grasp on the sheer size of the problem, let's talk about what this actually does to people. Let's move past the numbers and look at the very real, often hidden human cost of the diaper divide. You know, stats are one thing, but this is what it really looks like. This quote comes from a parent, and it's just gut-wrenching. Having to choose between feeding your family and affording a basic hygiene product, I mean, that's an impossible choice, a choice nobody should ever have to make. It really brings this whole issue down to earth in the starkest way possible. And that story, it is far from an isolated incident. This data shows just how common that impossible choice really is. Look at this. When asked how often they have to choose between diapers and other basic needs, 24% said frequently. Another 44% said occasionally. If you add that up, you get almost 70% of families in need facing this exact dilemma over and over again. And the fallout from these choices isn't just about stress and tight budgets. It gets medical fast. When you can't afford a clean diaper, what do? You might try to stretch the time between changes or even reuse a soiled one. And that leads directly to really painful, dangerous health problems like severe rashes, skin breakdown, and serious infections like UTIs that can land you in the hospital. And Dr. Samantha Eaker really sums it up perfectly here. It's a double-edged sword. You've got the physical side we just talked about, but then there's the emotional toll, the embarrassment, the isolation. For a child, it might mean they can't go to daycare, which in turn means a parent has to miss work. For an adult, it could mean they feel too ashamed to leave their home. It's this awful chain reaction that affects every single part of a person's life. So this is a huge problem. The question is, what is being done about it? Well, that brings us to our next section. We're going to look at a major piece of proposed legislation that's designed to tackle this crisis head-on. The End Diaper Need Act. So here it is, the End Diaper Need Act of 2025. And one of the first things to notice is that it's bipartisan. It has support from both sides of the aisle. The goal is really straightforward. Make diapers and other incontinence supplies more accessible and more affordable for low-income families and individuals of all ages, all across the country. Okay, so that's the goal. But how exactly would the law do that? Let's pop the hood and break down the nuts and bolts of this legislation to see how it's supposed to work. The act really stands on two main pillars. Think of it as a 1-2 punch. First, it pushes targeted federal money out to organizations so they can distribute free diapers and supplies.
And second, it makes a really key change to the rules around health savings accounts to help people afford to buy these items themselves.
So let's look at that first pillar, the funding. The bill sets aside $200 million every single year. That money would flow through a program called the Social Services Block Grant down to the states. And from there, it would go to the community organizations like diaper banks that are already on the front lines doing the work.
Now for that second pillar, which is a real game changer for a lot of people. Right now, as things stand, diapers are not considered a qualified medical expense. That means you can't use pre-tax money from accounts like an HSA to buy them. Well, this act flips that switch. It says, yes, medically necessary diapers are a covered expense. And that simple change could provide immediate, significant financial relief for families who have those accounts.
So the act seems pretty comprehensive, right? It covers a lot of ground. But like with any big piece of legislation, it's really important that we look closer. Who does it help the most? And are there any potential gaps?
And when you dig into the fine print of the bill, a really critical difference pops out. For kids with complex medical needs, the bill is crystal clear. It directly changes Medicaid law to cover 200 diapers a month, period. But for disabled adults on Medicaid, the path to help is different. It's more indirect. They would get support through those state-level programs that are funded by the new grants. It's a huge help for sure, but it's not the same as a direct, universal Medicaid benefit.
Okay, so what does that distinction actually mean in the real world? For the millions of adults and seniors on Medicaid who depend on these products, what's the bottom line?
What this boils down to is a potential Medicaid gap. The new grant money is a massive step forward, no doubt about it. But because it's not a direct Medicaid mandate for adults, a person's access to supplies could end up depending on how their specific state decides to set up its program. It's help, but it might not be as consistent or as guaranteed as it would be for children under this act.
And that really brings us to this final question. The diaper divide forces us to look at the real, tangible costs of not meeting a fundamental human need. It costs people their health, it costs them their financial security, it costs them their ability to just exist in the world with dignity. And so the question we have to ask ourselves isn't whether we can afford to fix this, it's what it's truly costing all of us not to.